All right, and we are live. So, hello everybody. My name is Dustin Honig, and I am a registered dietitian intern. And today I'm going to have a presentation for you all on the topic of chronic kidney disease and hemodialysis. So for starters, we're going to go over some of the functions of the kidney. Most of you are familiar with the role of removing waste products from the body. So the kidneys actually act as basically like a filter for the patient's blood. So they help to basically remove filter products out of the individual's bloodstream, and then those get excreted whenever you go to the restroom. The kidneys also have a bunch of functions that most of you may be a little bit more unfamiliar with. First and foremost, the kidneys are responsible for helping to activate vitamin D. They take on the largest portion of that role in the body. Basically, what they do is they activate vitamin D, and this helps keep bones strong by helping to keep calcium in the bones and to make sure that your bones do not leach too much calcium out into the bloodstream. Typically, your body wants to keep a balance between the amount of calcium in your bloodstream and your bones. Whenever one dips too low, it will draw from the other as a reservoir. So vitamin D helps keep bone density strong, can help prevent breakages, things like that in the long run. Kidneys also help to balance the body's fluids and electrolytes by excreting certain electrolytes like sodium and potassium are your main ones, other minerals as well, magnesium, calcium to some extent. It helps to regulate the amount of those in the body, and whenever they get out of balance, it can either retain electrolytes or it can excrete more. And by doing so, it helps to balance the body's fluids. So this helps to keep the body from retaining excess water when it should not. On top of that, the kidneys also release hormones and produce hormones to control blood pressure and to control the production of blood cells. So the kidneys are not only just a filter in the body, they also have another handful of other vital functions that keep your body running normally and healthy when the kidneys are healthy. So let me talk a little bit about chronic kidney disease. Basically, this is a progressive condition that's characterized by the loss of kidney function over time. Chronic kidney disease is generally caused by long-term inflammation and damage, which reduces the kidney's ability to perform its normal functions, like went over in the last slide. Kidney disease is also diagnosed primarily by testing the level of waste products in the blood, and testing the glomerular filtration rate, which we'll go over, I believe, in the next slide. And it's also classified into 5 stages, stages 1 through 5. Stage 5 is the highest level stage CKD, and it's also called end-stage renal disease. So the GFR, so the estimated glomerular filtration rate, it's a common medical test used to diagnose specific kidney disorders like chronic kidney disease, and is calculated by comparing an individual's creatinine levels to their age, body size, race, and gender. And what this test does, what it tells you, it basically determines how much blood gets filtered by a patient's kidneys in 1 minute. So when you're testing someone's estimated glomerular filtration rate, what you're looking for is a normal level of about 90 to 120 milliliters in a minute. That's about how much blood your kidneys can filter in a minute. And that gets affected whenever an individual is diagnosed with CKD. CKD is, the diagnosis is fairly dependent on the estimated glomerular filtration rate. So for CKD, as we went over before, there's 5 stages. The first stage, stage 1, is when you have a GFR greater than or equal to 90. Typically speaking, stage 1 CKD, it can be difficult to diagnose. It can be asymptomatic. Patients' GFR can actually be higher for a while. Whenever we go over some of the causes of CKD, you can see why this might be the case, but the GFR may appear to be normal or elevated in stage 1. Stage 2, generally you'll start to see some decline from your GFR. It could range from 60 milliliters a minute to 89. So it represents a mild to moderate decline in your glomerular filtration rate. excuse me, stage 3, 4, and 5, you'll also see a similar trend. Each of those has a progressively lower glomerular filtration rate, which means as you progress deeper into CKD, the amount of blood that's getting filtered by your kidneys each minute progressively becomes less and less, which means over time you're having less overall filtration of your blood, which can cause problems because waste product buildup. You have less waste product removal, so among other issues with CKD, that's something that's common, and we'll actually go over some of the treatments with that. It's very, very related to diet and hemodialysis. But before we get there, we're going to talk about some of the risk factors for CKD. So I kind of broke it down just for modifiable and non-modifiable. So for the non-modifiable, I'll start there. If you have family history of chronic kidney disease, if you are a type 1 diabetic, if you're an older individual, the older you get, the higher your risk. Or if you are an African American, Native American, or Asian American, all of these factors increase your risk of developing chronic kidney disease. So for the modifiable factors, you'll see diabetes again. Type 2 diabetes, that's one that can be changed, and that's actually one of the biggest risk factors for developing CKD is diabetes. Aside from that, physical inactivity, smoking, obesity, all three of which related to high blood pressure, and on top of that, alcoholism is something else that can cause damage. Chronic alcoholism can damage the kidneys. We'll actually dip a good bit more into these risk factors, primarily the modifiable ones because we can actually do things about those. So high blood pressure, we'll start there. So hypertension, this is one of the most common ailments affecting people across the world. And it's also one of the most prominent controllable risk factors that can adversely affect the kidneys. So over time, when your blood pressure is high, remains high, this can increase pressure and damage to the arteries of the kidneys, which slowly decreases their ability to deliver enough blood to the kidneys for filtration. So it's actually more so damaging your blood vessels than the actual certain other areas of the kidneys. So blood delivered to the kidneys declines, which can affect your glomerular filtration rate. On top of that, smoking, just as a side note, this is one of the risk factors because it can, among other things, contribute to high blood pressure, and it also, over time, can damage the internal lining of arteries. So smoking can directly contribute to chronic kidney disease. Yeah. So I kind of paired these together, obesity, diabetes, and chronic kidney disease. So obesity and diabetes and kidney disease, they're like, for lack of better terms, a trifecta of diseases that all feed into one another. So obesity is a major risk factor that contributes to CKD, mostly because it keeps the body in a state of continuous low-level inflammation. As we said earlier, low-level inflammation of any sort for long periods of time can lead to damage to organs, tissues, things like that. So chronic low-level inflammation, which is caused by obesity, can over time cause damage to the kidneys directly. On top of that, obesity is also problematic because it contributes to other comorbid risk factors, such as cardiovascular disease, high blood pressure, and, you guessed it, diabetes. Now, this is problematic because diabetes is tied to chronic kidney disease. So when you have chronic high blood glucose, that can cause inflammation in a different manner that obesity causes inflammation. And what this does over time, it can cause additional damage to blood vessels of the kidneys. So obesity feeds into diabetes, and diabetes and obesity both feed into chronic kidney disease. So these three, generally you can see appear together. Some patients will have all three. Occasionally they can have just one. But if you have diabetes, you are obese, you are at a much higher risk of developing chronic kidney disease. All right, so we're going to dip into some improvements because that's what we all want to learn about. We don't want to just hear about why a condition is bad. We want to learn about what we can do to improve it. So it's similar. The lifestyle changes to improve chronic kidney diseases are very similar for other chronic diseases. one of the things you'll almost always see is you want to exercise regularly. This can be mild to moderate intensity, but consistency is key. And the best type of exercise to improve your chronic kidney disease is cardiovascular exercise. If you're improving your health of your heart and the health of your circulatory tract, you will improve the efficiency and health of your kidneys. And on top of that, we spoke about obesity. So trying to maintain a healthy body weight is a lifestyle change that can drastically help improve your CKD. You want to stay hydrated. You want to make sure you're drinking enough water. Chronic dehydration can cause damage to kidneys because everything that's filtering out is much more concentrated and therefore more toxic. So you want to make sure you stay hydrated. Smoking is bad for the reasons that we mentioned earlier, with damage to your vessels primarily and inflammation. And your diet is crucial. Now this includes alcohol consumption. If you're a chronic alcoholic, not only going to damage your liver, you're going to damage every other portion of your digestive tract. Everywhere sees damage, and that includes your kidneys. So you want to limit or moderate alcohol consumption. Mild alcohol consumption, occasional, can actually provide benefits to your cardiovascular system and can actually reduce blood pressure slightly, which can provide some health benefits. However, overconsumption of alcohol can do the opposite. It can actually cause a lot more problems. And another thing you want to look at is nutrient density. So when you're consuming foods, you want to consume more whole foods, you want to consume less processed foods, less pre-made foods, things of that manner, and you want to consume things like fruits and vegetables. Those are where you're going to get most of your micronutrients from. And blood sugar, that's another thing. You want to try to maintain a healthy blood sugar. So you want to avoid try to limit your alcohol, try to eat healthier foods, and try to manage your glucose or carbohydrate intake, which is one of the best ways to manage blood sugar. If you keep your blood sugar in healthy ranges, it can help to prevent that additional inflammation that your body has to deal with on a daily basis. So it can help to slow the rate of damage or inflammation and slow the progression of CKD. So all these factors are honestly, they can all be crucial factors. Trying to maintain, all if not most of these lifestyle changes can drastically improve your condition of CKD and or slow the progression. So if, in the chance that chronic kidney disease does progress, which over time it generally can, as it progresses to stage 5, as we mentioned, is also called end-stage renal disease. The kidneys have already lost most of their ability to regulate electrolytes, filter waste products, and balance fluid, among their other functions. Kidneys have generally lost about 85 to 90% of their function at this point. So with this, generally one of the first things that you'll see happen is this can cause a buildup of waste products. Buildup of waste products. That is a typo there. We don't like that. So yeah, the second bullet is a buildup of waste products in the blood and uncontrolled electrolyte levels. And this is generally what causes the necessity of hemodialysis. So for those that are unfamiliar, hemodialysis is a treatment, one of the most effective treatment options for individuals with CKD, and it basically requires the use of a machine that acts similar to an artificial kidney. This machine picks up some of the filtration roles of the kidney. So you have a patient come in for hemodialysis treatment. They have an artery and a vein connected in different manners to the machine. And basically, the unfiltered blood will go in through the machine, go through the dialyzer, and basically it filters out some of the waste products, some of the proteins, some of the electrolytes, a good bit of everything that's in the blood, and it puts the filtered blood back into the body through the other lead. So it basically can pick up some of the filtration of the kidney and prevent toxic buildups of the waste products, electrolytes, fluids, things like that. All right, so now that we've gone through most of chronic kidney disease, I have a little handout for all of you guys just to take home and, kind of has like a brief, breakdown and introduction of what CKD is, what a hemodialysis is, and all of like the role of the kidneys, It summarizes a lot of what we've gone over already throughout this presentation, as well as the risk factors. When you have these certain signs and symptoms, it might be a good time to see your doctor that are listed on this sheet, like your nausea, vomiting, changes in urination habits is one of the most common, as well as edema, itching, and fatigue. These are all signs and symptoms of chronic kidney disease and are good reasons to see your doctor if you have not already about this disease. But yeah, it has also like I said, the controllable risk factors, complications if you fail to adequately manage your chronic kidney disease. And it has a brief explanation of hemodialysis. So this is just something to reference whenever you take home, or as something to take home, just for a little bit of additional information. And you've made it through my presentation. In summary, chronic kidney disease is a condition that develops over time, and it will progressively reduce the kidney's ability to perform all of its normal vital functions. The primary complications seen from chronic kidney disease, I don't believe I mentioned earlier, but they are anemia, because like I said, it produces hormones that are crucial to the production of red blood cells. So when it's not producing that in adequate levels, then your production of red blood cells decreases, which can cause anemia. On top of that, bone problems and bone disease. Your kidneys activate vitamin D, which is essential to bone health. So when they're unable to do so adequately, your blood levels of calcium go a little bit out of control. Your body is unable to store calcium in the bones as well as it should. And it can cause a slew of other problems, including heart issues when you have calcification of blood vessels. On top of that, you get the waste product buildup, as we mentioned earlier, electrolyte imbalances, which are for the same reason of waste product buildups, inadequate filtration, and edema, which is also directly related to those two because the kidneys are no longer able to eliminate fluids as well as they should. And as I mentioned, hemodialysis finally is a treatment option for chronic kidney disease patients, and it's used to help filter waste products from the blood when kidneys are no longer able to. So it's a treatment option, should typically done generally about every other day. It can kind of help keep the body levels of waste products and metabolic products in check while the kidneys are less able to do their job. And that is all for today. You've made it through my first PowerPoint presentation of chronic kidney disease and hemodialysis. Stay tuned for part 2 and part 3. I appreciate you guys. I'll see you soon.